Good evening, and thank you for joining us for session 3 of our 5-part series on autism, where we'll gain a better understanding of autism spectrum disorders and learn about practical interventions. Today's session focuses on social and communication issues in autism. A couple of housekeeping notes before we begin. In this platform, all attendees are muted. While you won't be able to ask questions audibly, please note the QA function on your screen. If you have a question that is not addressed during the presentation, please feel free to submit it through the QA feature, and we will address as many questions as possible before the end of our session today. Also, today's webinar is being recorded and will be posted on our website. As a registrant of today's session, you will receive an email with the link once it's live. Please allow 1 week to receive this. It's now my pleasure to introduce our presenters for this session. We are fortunate today to hear from an autism expert who specializes in speech and language. Michelle Min holds a master's degree in speech language pathology from CSU and works in the Cleveland Metropolitan School District as a speech language pathologist with elementary and preschool students. Michelle holds her certificate of clinical competence from the American Speech Language and Hearing Association, as well as licensure from the Ohio Speech and Hearing Professionals Board. Also with us tonight for the QA portion of our program is Dr. Christine Berry, a pediatric neuropsychologist at UH Rainbow Babies and Children's. Dr. Berry specializes in the diagnosis and treatment of children and adolescents with autism spectrum disorders, as well as other neurodevelopment disorders. Dr. Berry, along with Kathleen Maxwell, are founders of this autism series, now in its 18th year. Now I'll turn it over to Michelle to start our session. Michelle?
Hello, everyone. Thank you so much for coming today. And thank you, Tia, for that awesome introduction. I am very excited to be here. As Tia mentioned, I will be covering communication and social impairments that are typically found in autism. And I'm just going to get right to it. I have a lot I want to cover in not a lot of time. So here we go. One of my goals throughout this presentation as well is to show how communication and social abilities really go hand in hand. They are very codependent on each other, and it's really difficult to truly separate the two. Before we even really get into the deficits that we find in autism, I do want to talk about what typical communication looks like and what typical language development looks like, what we would kind of expect as far as a child's language development. So what is communication? Communication, a very basic definition of it is it's the process of sharing information between individuals. This includes needs, desires, perceptions, knowledge. At its core, communication is a social process. We as human beings tend to be very social creatures. Our drive to communicate comes from a desire to be social. I don't have time today to get into all the neurological aspects of things, but essentially, in most human beings, when we communicate with others, when we socialize, our brains release dopamine, which is the chemical that makes us happy. We enjoy it. We're motivated because we feel good afterwards. Children on the spectrum don't always get that happy chemical release when they communicate. So they may not be as driven to communicate as we would be or as we would expect them to be. So there are many different types of communication. There's intentional communication. Intentional communication is any form of where you're conveying a message that is intentful. There's a purpose behind your message. You're truly trying to convey something. This can include things like pointing, signing, speaking, any way where you are purposely trying to convey a message to your listener. Then we have unintentional communication. This includes things that might not be, at the forefront of our brains while we are communicating with someone. This includes things like body language, tone of voice, even your posture, things that definitely do send a message, but you might not be fully thinking about as you are communicating with others. We also have conventional communication. This includes any kind of language system. This would include English, German, Spanish, Arabic, any kind of language that follows a set of rules. Most people probably do tend to think of more verbal languages as conventional forms of communication, but American Sign Language would also be considered a form of conventional communication. We also have unconventional communication. This is a type of communication that we use that might not be socially appropriate, but is still definitely conveying a message to its listeners. So examples of this would be crying, throwing a temper tantrum, grabbing someone's face to get their attention, tugging at a pant leg to get attention, or even, pulling your arm and dragging it over to something that a child wants. Think about very, very young children and how they might communicate with you and without using words, and maybe in not a very socially acceptable way. And then we have verbal communication. I think that's what people tend to think of when they think of communication. When they hear the word communication, they think of our voice, they think of us talking, and that's exactly what verbal communication is. And then we have nonverbal communication. Nonverbal communication includes things like, well, anything that doesn't include your voice. It can include pointing, signing, using pictures even. Body language, really any way that you're conveying a message without actually verbalizing to convey that message. It's also kind of important to note that you can stack these types of communication, so to speak. So for instance, right now I am using an intentional, conventional verbal form of communication. It's intentional because I'm purposely delivering this knowledge to you. I have a purpose behind my message to you. It's conventional because I am using the English language, which many, if not all of you, are fully fluent in and understand the rules for. And it's verbal because, again, I'm using my voice to convey that message. You could even argue that I am using nonverbals because I tend to talk with my hands and gesture, but I'm not sure how much of that you can see over Zoom at this point. So now I want to talk about the communication matrix. This is a tool that's really important to speech language pathologists because it's a way for us to measure language development in children. And then we are able to take children who might not be developing language in the way that they should be and determine where they are developmentally and build on the skills that they have, help them get to the next step, so to speak. So the first level on the communication matrix is pre-intentional behavior. This includes behavior that's not necessarily under the individual's control, but it reflects their general state. So this stage typically occurs between 0 and 3 months of age. So think about an infant. An infant will cry whenever they are in any kind of discomfort. If they're hungry, if they're tired, if they need a diaper change, they're going to cry. And it becomes the responsibility of the caregiver to determine why they are crying, what it is that they need. It's almost reflexive, and it really does rely on the caregiver to interpret what that behavior needs. The second level that we have is intentional behavior. This is behavior that is under the individual's control, but it's not used to communicate quite yet, not used to communicate intentionally quite yet. This is where caregivers interpret from things like body language, facial expressions, eye gaze, even vocalizations, things that the child is kind of exploring with, kind of discovering about themselves. And they are learning how to behave, learning how to communicate in this stage. This typically occurs between 3 and 8 months of age. Next, we have unconventional communication, which we kind of talked about in the previous slide. Unconventional communication typically occurs between 6 and 12 months. And it includes body movements, simple gestures like, tugging on a sleeve, patting someone on the leg to get their attention, facial expressions. They're unconventional, again, because they're not necessarily socially acceptable as we get older. As we get older and as we start to get into school, it's not as appropriate to grab someone's face to get their attention. It's not as appropriate to, especially in these days, to touch someone to get their attention. It's more appropriate to use their words to get the attention of someone. Which leads us into level 4, which is conventional communication. This is communication that is much more socially acceptable. It includes things like pointing, nodding your head, shaking your head no, waving, hugging, looking from one person to a desired object even. It's much more socially acceptable, but it's not quite at the level of using verbal language either. Uh, this tends to occur between 1 and 1.5 years. Um, and it's really when we start to see more, conventional and appropriate forms of communicating to others. Level 5 is concrete symbols. Concrete symbols are symbols that physically resemble what they are representing. So they're going to look like, feel like, sound like, move like what they represent. This will include things like pictures. If you're looking at a book and you see a picture of anything, a chair, that looks like what you would expect a chair to look like. That's an example of a concrete symbol. Another example of concrete symbols would be common gestures. So if I want to gesture that I want to drink, I'm going to kind of cut my hand a little bit, look like I'm holding a cup, tilt it back to my lips, look like I'm drinking something. That's a common gesture, and it looks like I'm holding a cup and taking a drink from it. Concrete symbols would also include sounds. If we think about, children when they're learning language, we tend to talk about animals and what sounds do the animals make. So sounds would be considered a concrete symbol as well. Many children skip this stage entirely. Some combine it with the next stage, which we're going to talk about in a second. And still to others, this is the best stage out there. Many children on the spectrum tend to be very concrete thinkers. In other words, they like to know exactly what they're talking about. They don't like any kind of abstraction in their world. And concrete symbols really give them a great way to communicate. This stage tends to occur with the next stage, abstract symbols, between 1 and 2 years of age. Abstract symbols, which is level 6, are symbols that do not physically resemble what they are meant to represent. So this includes things like speech, sign language, printed words. As I'm talking to you right now, the words that are coming out of my mouth are not coming out in the form of pictures. They don't look like or feel like or sound like what they're representing at all. They're just sound waves. That's what makes them so abstract. In this stage, between the ages 1 and 2, these symbols are used one at a time, and sometimes in conjunction with a concrete symbol, like I just kind of mentioned. But it's the start to the next level, which is language. And language is when those symbols, whether they be abstract or concrete, are combined into 2 and 3 word combinations that follow a set of grammatical rules. This tends to occur around 2 years of age. And that's really when we start to see a huge language boom. That's when we start seeing children really take off, and their vocabularies grow significantly when they turn 2 years old. So I'm not going to go through this entire chart. I just kind of wanted to show what the matrix looks like. The matrix is then, I take those 7 levels and it's organized into this graph, and it's organized into 4 major reasons to communicate: to refuse, to obtain, to socialize, and to gather information. I just also really quickly wanted to highlight the organization of it, meaning that, refusing and obtaining tend to occur in more earlier stages of language development, and then socializing and gathering information tends to occur in more later levels of language development. But you can also see here very clearly how if I look at a child and say, okay, well, Joey is able to request an object, but he's still struggling to make choices, I can then figure out from this assessment and figuring out exactly where the child falls developmentally and determine what the next appropriate steps would be to help them get to the next level of communication. It's a really helpful tool. So what communication deficits are typically found in autism? Well, now that we know what typical communication and language development looks like, I do want to remind everyone really quickly of what the definition of autism is according to the DSM-5. In short, it's neurological development disorder characterized by deficits in social communication. So by definition, autism is a social communication disorder. That means we will see many, many different types of language disorders. It's that's what they are looking for when they are giving that diagnosis of autism, to see what kind of difficulties a child may have in those social communication um, abilities. So just to keep it pretty simple, you're going to see verbal language impairments, you're going to see nonverbal language impairments, and you're going to see social interaction impairments. I'm going to get into more details about all of those in a second here, but I wanted to highlight as well expressive language disorders and receptive language disorders, because those are really the most common that I see in the school, paired with autism. Um, Expressive language disorders, our expressive language is our ability to communicate with others. It's to express ourselves, like it says, to convey our thoughts, feelings, perceptions, whatever. An expressive language disorder is when a child has difficulty expressing themselves for whatever reason. They may have a hard time, they may not have an appropriate vocabulary to do so. They may not understand how to use language. They may not understand that words hold meaning to them. And by using words to communicate, they can have their needs met. Um, Receptive language disorders, our receptive language is our ability to understand and then to appropriately process and react to what is being said to us. We do tend to see kids on the spectrum who have a harder time taking in information. Their receptive language is a little bit lower, well, is significantly lower than that of their expressive language. They have a hard time processing information and learning how to appropriately respond to it. If I were giving a standardized language assessment to a typically developing kid, I would expect that the receptive language would be slightly higher than the expressive language. And I would expect that across the board for any age, really. If you're typically developing, that's what I would look for, because if you think about it, we tend to understand more than we are actually able to say. So for instance, if you've ever been in a situation where you're talking to someone and they use a word that maybe you're not familiar with, we are typically able to gather context clues surrounding that word and figure out what it's meaning through those clues. We might not be able to use that word expressively, especially up until that point if we had never heard of it, but receptively, we were able to decipher it and understand the meaning of it. In children on the spectrum, we tend to see the opposite, where expressive language scores are significantly higher than those of receptive language scores. There can be many reasons for this. I just read a study that showed that attention plays a role in this, or can play a role in this, but there are also many theories and studies out there that talk about how children on the spectrum tend to be very internally driven, meaning they're very focused on themselves and their needs and what they want to say, what they need. They may have a hard time processing what someone else is saying to them and then responding to it appropriately. So verbal deficits that we do see in autism, the biggest key indicator and what I hear most often in the schools is that their child got a autism diagnosis because they were talking to their physician and they realized that their child was not meeting language developmental milestones. So this can include things like not having a vocabulary that's appropriate for their age. They're not following directions. Again, they're having a hard time processing that. They don't respond to their name being called, or even to other environmental noises. Um, something that I do want to highlight as far as verbal deficits go, we do tend to see challenging behaviors in children with autism. And there are times where an inability to communicate can be one of the causes of these challenging behaviors. Joey's acting out because he can't communicate with us. He's frustrated. And that is absolutely true. And that absolutely does happen. However, I do want to highlight that that is not always the case for challenging behaviors. We do see challenging behaviors for other reasons as well. It can be sensory overload. There are many other factors that play into behaviors. And I hear a lot in the schools that, Joey ran out of the classroom and it's because he couldn't communicate with us, so he ran out. And while that may have something to do with it, it could also be because the classroom was really loud and Joey's reflexive response was he was in sensory overload and he ran out of the room to get away from being overstimulated. So challenging behaviors absolutely can be a direct result from not being able to communicate, but that's not always the case. We do also see echolalia in children with autism. Echolalia is like parrot talk when kids repeat what they're hearing back to whoever said it. Some echolalia is normal. Up until about 3 years of age, this is pretty normal. This is when kids really, again, they have that language boom. They're picking up on words, they're learning what they mean, and they're repeating what they hear. That's pretty normal up until about age 3. There are 2 different types of echolalia. There's immediate and there's delayed. Immediate echolalia is when a child hears something and repeats it back within seconds. That's immediate. There's really not much time in between hearing it and repeating it back. Delayed is there's a little more time. This can be hours, days, even a week after hearing it that they start repeating it back. If a child is able to repeat sentences that are significantly longer than what they're able to produce independently, this can indicate that they do not understand the use of words as individual units. So in other words, they don't realize that each individual word holds its own meaning. They may have a real difficulty understanding language and how to use it if they are really repeating these really, really long sentences. If a 4-year-old's able to repeat a 15-word sentence, but not create a 15-word sentence on their own, this can really show that they don't understand what language is. They're just hearing these sound waves. They hear mom and dad doing it and saying it, and they're just going to repeat it back because that's what they think they should do. We also tend to see jargon. Jargon is often mistaken for babbling. It's when a child is using unintelligible words, but in a normal intonation pattern. So it almost sounds like they're holding a conversation with themselves or with another child, but you don't understand what words they're using. They sound made up. And I hear that a lot from my parents as well, is that, oh, she holds conversations with herself, but I can't tell what she's saying. It's like she's using her own language. That's jargon. We may also see in children who do have a good handle on communicating and really know how to use language, we might see things like inappropriate tones of voices. So using kind of a sing-songy voice or a robotic voice, we can see those kinds of verbal deficits as well. And those directly play into a social aspect. As we get older, as we get into school, we don't want to be using sing-songy voices. We don't want to be using robotic voices. People are going to notice that and mention it, and maybe not in a nice way necessarily, and that could lead into some social deficits. Nonverbal deficits that we tend to see. We tend to see difficulty with using common gestures and even pointing. Gesturing and pointing, they really require a lot of motor planning. It really requires a lot of motor planning to make a fist and then use one finger to point and then indicate exactly what I want. That requires a lot of planning. Same with gesturing. It can be really difficult for kids on the spectrum. So they will often use unconventional forms of nonverbal communication in this sense. They will instead of gesturing or pointing to something that they want, they may take an adult by the arm and pull them over to what they want. It's much easier to grab mom by the arm, walk her over to what I want, and show her that way than it is to take one finger and point to it. We're going to see deficits in eye contact. And as they get older, this can come off as seeming uninterested or rude, even if you're not looking at the person talking to you and you're looking all around the room, that comes off a certain way when to communication partners. They may have a hard time reading body language or facial expressions. Again, because many times they are so inwardly driven, they have a hard time relating to others. And not to mention that body language and facial expressions can be a very abstract concept for these kiddos. They have to be taught to them in a concrete way for them to better understand them and be able to relate to them. And then again, following directions can be a really tricky thing for some kiddos on the spectrum because they don't process the information the same way that you and I may. They may have a hard time processing it, and they may even focus on details of what you're saying, but miss the big picture. We tend to see that a lot with children on the spectrum who really perseverate, or they really, really dial in and focus on one thing that you said, but it's kind of a minor detail and it doesn't really apply to everything else that you said. Some of the social deficits that we see. Again, as I kind of mentioned, I don't have time for all the neurological aspects of it, but if a child is not getting that joy from socializing, from communicating, they are not going to be as motivated to do it as someone who is. Therefore, we tend to see a decreased initiation of communication bids. In other words, a child on the spectrum may not initiate conversations as much as typically developing children would. This also will make them the responder, so to speak, in conversations, and tends to make conversations shorter than typical conversations may actually be. We're also going to see difficulties in joint attention. Joint attention is when you have two people focusing on the same object. So if you are reading a book to your child, that is a form of joint attention. We do tend to see children who really are not interested in that. They don't want to, they'd rather be by themselves. They don't have any interest in socializing and holding that joint attention with someone. Turn taking is absolutely something that we tend to see them struggle with. And this can be in conversations, turn taking in conversations, they may either interrupt or they may not take their turn or may use it inappropriately. And even playing games, younger children may not want to play games with peers. They may rather play by themselves so that they don't even have to worry about turn taking. Again, that eye contact, it is a nonverbal form of communication, but it's also so big in our socializing. It's something that people do find rude. If you are not looking at them, they might think that you're being rude, that you don't care about them, that you're looking for something better. And again, the tone of voice, we want it to be more appropriate. We don't want kids to kind of single someone out because they're using a robotic voice instead of just a normal voice. And then again, with that empathy, understanding others' feelings might be a little bit more difficult for children on the spectrum. So, talking about treatment and intervention strategies to help increase communication. This is my little disclaimer spiel. Keep in mind, autism spectrum disorder is exactly that. It's a spectrum. Interventions are not a one size fits all. Best treatments are absolutely individualized to each child. And just a favorite quote from grad school, if you've met one child with autism, you've met one child with autism. So in other words, I have found success with some of the tools I'm going to share with you. I hope you do too, but every child on the spectrum is different. There's not any two who are the same, and they all respond differently to different treatments and interventions. One of the biggest things that I recommend is using highly motivating activities. Again, if a child is not motivated to communicate with you, if they don't have that internal drive to communicate, they're not going to. So if you combine communication, which is something that they are not really motivated to do, with something that they are really motivated to do, you're going to see more success. So use themes most interesting to the child. Make sure that they're interactive. Always follow the child's lead. And also, it's better if they can be repetitive because more repetition is more practice on that target skill. I am currently working with a kiddo on my caseload who loves putting things into a container. She could do it all day, and it works for me because I can target skills with that. I can target words like more or open if we're opening the container. And it's very highly motivating to her. And she's happy to work with me when I'm doing an activity that she really loves doing. Definitely don't overcomplicate anything either. You want a child to focus on your target skill, your target word that you're working on. You don't want them to have to focus on lots of other factors while you're working with them. So working on echolalia, which is again, when a child is repeating what they're hearing, do not encourage the child to repeat. Do not tell your child, say block, say car. By doing this, you are showing the child that it's not necessarily their responsibility to communicate. They are going to rely on you to tell them what to say. And that's not what we want at all. We want communication to come from the child. We don't want the child to be relying on us to tell them what to say. We want it to be a unique and individual, important thing to them, not because they think they need to say whatever we're telling them to say. Definitely model language as the child would say it. And by it always avoid asking questions to a child who's echolalic. Asking questions is just going to frustrate you. It's going to frustrate the child. The child's going to repeat what you say, and they probably won't understand what the question means anyways, and they might not have the language quite yet to answer it. So instead, narrate things around you, expose them to that language, label things, teach them, expose them to that language. As they get exposed to more, there's a better chance that they will start putting the abstract symbol of the word together with the actual concrete physical object that it represents, and they have a higher chance of being able to use it on their own at that point. So jargon. This is, again, when a child sounds like they're having a conversation, they're kind of babbling, they're using words that are very unintelligible. Always respond. If you hear your child playing with something and just talking to themselves using jargon, respond. Hold a conversation with them. You want to match their pitch and their tone. So if it sounds like your child is asking a question and kind of raises their voice at the end, respond to them with an answer. And then you ask a question back. Teach them that reciprocity of holding a conversation. Even if this is an unconventional form of communication, you're still teaching basic conversation skills, and that's huge. That's a great thing. If you know what they are referring to or what they're indicating to, model that language. So if your child is playing in a play kitchen, talk about what they're doing, talk about the foods that they're picking up. If they're just sitting there playing with a doll or a ball, talk about it. Use real words to communicate with them and really model how to hold an appropriate conversation. Core vocabulary words. Core vocabulary words are high frequency words. They're the words that are most commonly used in the English language, and they're typically verbs, adjectives, or prepositions like open, on, off, in, out, or go. I like using core words. Core words are also multiple meaning words. So I have learned in my time in the school that using and teaching core words really helps to increase functional vocabulary. Teaching a child one core word opens up so many opportunities to communicate to that child. So for instance, like I said, there are multiple meaning words. So if you think about the word open, I can open a door, I can open my mouth, I can open a window, I can open a present. The word open alone can be used in so many different contexts. The word on, I can turn on a light, I can put on clothes, I can go on a bus. There are really so many, you're opening up so much potential to communicate by just teaching one core word to a child. There are people who don't feel that core words are as beneficial as other words may be. I think that they are. I've seen success with that, which is why I'm talking about it, and it is evidence-based. But most nouns are not core vocabulary words. If you think about how often you use the word phone or computer, it's nowhere near as often as you use the words like open or on. You just tend to use verbs more than nouns. And that's why teaching these core words can really be a game changer for children who don't have a ton of language at this point. Also, if a child is minimally or nonverbal, encouraging the use of single core words at this point can get a lot done. But if they are using single words, definitely pair it, with another word. You want to meet the child at the level they are at. So if they're not using words, encourage one word. If they're using one word, encourage two words, and just build off of that. Requesting. So I do this a lot with my preschoolers. Obtaining was one of the 4 major reasons to communicate. And I can pair this very easily with teaching core words because, again, you're using a single word to make things happen. Especially when we were working remotely, I have a green screen behind me. I would use my green screen to encourage requesting and to encourage single core vocabulary words. So I would have a picture of an elevator behind me. And if we were targeting the word open, I would pair the word open with the basic sign for open. And usually the parent, if we were in the beginning stages, the parent might be doing some hand over hand and helping do the sign. And every time the child signed open, the elevator doors behind me would open and a fun GIF of some animal doing something silly would happen behind me, and they loved it. It was really motivating for a lot of children. On a side note, I did find a lot of success with some of my more severe children on the spectrum with my green screen. But point being, requesting using a few single words to make things happen is a great tool to teach as well. And also encouraging conventional gestures. So instead of the child taking your arm and grabbing you and taking you to something that they want, a desired object, encouraging the use of pointing like this, or kind of gesturing to what they need or for what they need, makes requesting a lot easier, instead of, those unconventional gestures that we had talked about as far as getting people's attention or taking them over to get some desired object. Visuals are invaluable to children on the spectrum. Again, they tend to be very concrete thinkers, and visuals help to explain how much, how long, what is expected, and when things will be over. All things that children on the spectrum want to know when they go into unfamiliar situations. They like concrete. They don't want to be surprised. And using visuals helps to not only set your expectations and show them exactly what you are expecting of them, but it also it also helps to ease anxiety over the unknown. It shows them what is going to happen. So using things like visual schedules, picture schedules, which is exactly what it sounds like, pictures of what they're going to be doing throughout the day. Every time that they finish doing something, you take that picture off of the schedule and put it away, and you go on to the next one. It's a really great way to show them also that they're not going to be stuck doing something that they might not enjoy doing. If you're in school and they don't like circle time, these picture schedules, these visuals will show them that circle time's not going to last forever. You are not stuck in circle time forever. After circle time, we're going to do centers. And after that, we're going to have lunch, whatever the case may be. And it's showing them that we will eventually move on. It makes expectations very clear. Visual timers. I use the Visual Countdown Timer app, which is a free app on the App Store. And I can set the timer for a specific amount of time. And as that time gets less and less, a picture starts to be revealed behind it. So it takes that really abstract concept of time, which is a very, very abstract concept, and makes it much more concrete. It shows the child how the time is moving, how it's becoming less and less, and whatever we're working on at that time will eventually be over once the picture of the rubber duck or whatever it is fully revealed. Using things like first then charts, which you typically use when a child may not want to do something that they need to do. And you say, okay, here's a picture of work. First, we're going to work, then we're going to play. Or first, we're going to brush our teeth, then we get to play with dinosaurs. Whatever the case may be. Again, setting those, expectations and those helping them to realize that brushing their teeth is not going to be forever. They're not going to be stuck doing this forever. After they brush their teeth, then they get to do something else. Using reward charts and showing what they're working towards is a great tool as well. And obviously for children who are just kind of starting out, you may want to make the target you don't want them to have to work super, super hard for their target. You want to kind of like ease them into it, maybe have them do the target behavior, the target word, whatever, 3 times if they're just beginning. And then as they get better, obviously increase the amount of times they have to do it to earn their reward. Using social stories. Social stories are stories that talk about situations that they may come into. I have a very good coworker and friend of mine who wrote a social story about having to wear masks in school and how we have to wear masks in school. We can take them off when we're eating. There may be breaks that we get to take them off for, but for the most part, we're going to wear them at school to keep us safe. And when we get home, we get to take them off again. It's okay. It really sets those expectations of, the mask can be very anxiety inducing for some of my kiddos on the spectrum. And it really set the expectation for, you're not going to be wearing the mask forever. You will get to take it off. It's going to be okay. But while we're at school, we're going to do it. And this is why. And then offering break choice cards. So if a child is working with you and they're doing a stellar job, which they always do, and you can tell that they need a break. They're getting kind of saturated with whatever you've been working on. Um, Offering them choices, options to choose from of what they can do instead to take a break is a great way to kind of transition into that. Also, offering those choices helps to lessen the probability that they're going to ask for something that you don't have, which could cause an issue as far as, tantruming, being very upset that you don't have. It may seem like you're saying no to a break completely when you may not just have the option that they would prefer. So giving them those break choice cards shows them exactly what they can choose from. So augmentative and alternative communication, AAC. AAC is a term for multiple ways of communicating that help with severe communication disorders. It's a way for children or people in general who have a hard time uh, communicating verbally to express themselves. And it's definitely marketed that way as well. It's marketed as a voice for the children. And it is an absolute incredible tool for minimally verbal or nonverbal kiddos, but it's also not a magic solution for an inability to communicate. Kind of like how we were talking about with children who are echolalic, they are having a difficulty understanding that words have meaning, that language has meaning. If a child doesn't understand language, doesn't understand how to use language or show that it shows meaning, they will struggle using a device to communicate. Giving them a device to communicate will not solve their inability to communicate at that point. They need to understand language. They need to understand that it has a meaning in order to be able to functionally use these devices. AAC can include sign language, language boards, pictures. I have children who picture exchange. They'll give me a picture and that's how I know what they're requesting. And it can also include things like devices or apps such as an iPad or a tablet, which I think is what people tend to think of most as far as AAC devices, AAC communication. I try to pair AAC communication with other forms of communication as well. So I will pair sign language with a verbalization as well. I really want to find the best way for a child to communicate, the best and easiest way for them to communicate. So I am running out of time here because they do want me to leave some time for questions, but I'm going to talk really quickly about some social skills that we may see deficits in. So again, that social initiation and reciprocity. Social initiation can be really difficult for kiddos, whether they're just not motivated to do it or maybe they just don't understand how it works. So having role plays on how to initiate social interaction and also even reading social stories about how to engage with friends and how to hold conversations, that can really help as far as building those social skills. Discussing body language and facial expressions, those can be pretty abstract concepts. So having children look at pictures of other children who are having certain emotions and talking about what they look like, how they're feeling and why they may be feeling that way. And also using peer groups and models. Using peer groups to kind of show how to use appropriate social skills is great. Really engaging other kiddos in the classroom and showing how to appropriately make friends and interact with friends can be invaluable. And absolutely using real life opportunities to grow from. The best way to learn is through real life. I could sit in a therapy room with a child for hours and hours and hours and not be able to prep them for every social experience that they may have. So discussing real life social interactions is much more applicable and it can be a lot more helpful than sitting in a therapy room and kind of guessing like, well, you may come into this situation and when you do, here's what you would do. Talking about real life is just much more relatable and meaningful. So I do have time for questions now. I thank you guys for listening. I hope that I was able to teach something.
Yeah, no, you've been great, Michelle. Thank you so much for this wonderful information. And joining us now is Dr. Christine Berry, our neuropsychologist from Rainbow. And we do have a few questions that have come in. So I'll just go through them one by one. This question asks, how do I find a speech therapist who can work with a 13-year-old who needs help breaking down and learning social skills?
So definitely talk to your physician, and be you know be open with your concerns about it. They may have speech therapists that they know of who can help with that specifically. I would definitely recommend, looking into outside services. And if they don't qualify for school-based services, um, but there are many speech therapists out there. I know UH has so many amazing programs that, I mean, maybe Dr. Berry can talk more about specifically to UH what they offer, but I'm sure that they have plenty of speech therapists who specialize in that type of therapy.
Yes, just to add to that, we have wonderful speech therapists at UH that you can contact at the number below. In addition to that, we have Cleveland Hearing and Speech that has wonderful speech pathologists. You can also look on the Milestones website, which was listed last week. It's just www.milestones.org. It's a website that's out there that lists resources for families just for this reason, so you can find who is covered on your insurance plan.
Perfect, thank you. And then this one is specific to one of the points you brought up, Michelle. Is there an age limit for the use of first then charts?
No, not at all. If that is working for your child, keep using it. Don't stop just because they feel they've hit a certain age. If that is something that benefits them, keep using it. Keep using it for sure.
Okay. And this one, my 3.5-year-old granddaughter stares off into space. You can call her name, poke her, or throw a ball at her and get no reaction. Also, she may just sit by herself and laugh. Not sure if I should just let her do this or not. Her communication skills are getting better, putting 2 to 3 words together.
Okay, well, good. I'm glad that she is putting 2 to 3 words together. That is a great sign as far as, being able to communicate with others. It's hard for me to tell without actually seeing your granddaughter, but it sounds like that receptive portion, that receptive language might be struggling a little bit. Like I said, children on the spectrum can be very inwardly driven. They are not always aware of what's happening around them. And that's how one of the things that we tend to see is with parents who are concerned that their child may be on the spectrum is that they are not following directions. They're not paying attention to environmental noises around them. They are just being very, very inwardly driven by themselves. If she is sitting by herself and laughing, I would engage with her and try to, start a conversation with her, try to talk about something else, or even figure out why she's laughing. But I'm very encouraged to hear that she is using 2 to 3 words, stringing them together. It sounds like she is moving towards that language level of the communication matrix, which is where we want her to be at that age.
Sure. And this question, and I think I know the answer to this, but is speech therapy available for young adults?
Yes, absolutely.
I
Yes, it's available to anyone who needs it, any age.
Okay. And then since all children were forced to learn remotely for several months and have become accustomed to that environment, what is one method of SLPs and educators should be very cognizant of as autistic students return to the classroom? How can we best help ease the transition?
This is a great question. Because you're right, we have been in such a different environment for so long. Children on the spectrum may be having a difficult time transitioning back into school, especially if their routine at home is significantly different from their routine at school. So I would absolutely encourage lots of pictures, lots of visuals, picture schedules, I think, are going to be a huge thing to rely on as we make the transition back into school, so that they can kind of expect what's coming next. And for the kiddos who, may just want to go home and see mom, when they will be going home to see mom. I know you only asked for one, but I would also say visual timers for kiddos who maybe didn't have to focus a lot of attention onto activities while they were at home. At school, we might have to spend 5 minutes doing this. So using visual timers to kind of show how long something's taking would also be a really good thing for kiddos on the spectrum as we transition back into the classroom. That's a great question. Thank you.
Yeah, great suggestions. Thanks. Is the cost of therapy covered by insurance or government?
It depends on your specific insurance plan. You would have to look into that depending on what kind of insurance you do have. A lot of insurances do cover a set amount of therapy. And they also require that a physician had recommended the therapy, had prescribed the therapy to begin with. Dr. Berry, is there anything I'm missing on that?
No, I think it depends on the insurance. It depends on the diagnosis very often also.
Yeah, so you should be able to contact any program department and find that out. Okay. And here's a really great comment. The attendee says, "Hi, Michelle. I'm curious if you plan to continue using remote therapy for some students after COVID. Will it be part of your therapy tool bag?" And she says, "Thank you so much. You gave an amazing presentation."
Oh, well, thank you. And hello. The answer is yes. I am still seeing some students remotely. I have found that for some of my kiddos, they really thrive with it. Like I said, I use a green screen, so it tends to be more like I joke around, I'm Steve from Blue's Clues, and I kind of have to pretend that something is happening behind me and I've become a TV show character. But for some kids, especially the ones who are on the spectrum, they've really thrived with it. And they have shown, a lot of them have shown some of the most progress out of any of my kiddos throughout this time. Honestly, I was kind of shocked by that, but I'm also really happy about it. So yes, I would definitely try to keep this in my therapy tool bag for sure. I spent $16 on a green screen and it was probably the best investment I made during 2020, but it's been wonderful. And I definitely, even if all kids came back into the building, I would even consider doing remote therapy from my office if the teacher would set up a child on an iPad or a tablet in their classroom and allow me to work with them that way. I would definitely consider that. Yes.
Okay, and this question, what about a child who enjoys other children, but due to sensory issues such as auditory sensitivity or sensory overload, does not enjoy more than one person talking at a time?
That's a tricky situation. I'll be honest with you, that's tough because we do want to encourage those social skills. I would wonder how old the child is if we gave them a social story to kind of rely on, or some visuals as far as this is what to expect when more than one person is talking. I would also kind of collaborate with an occupational therapist who would probably have a better handle on the sensory aspects, and talk about maybe wearing some headphones, something to kind of lessen that auditory stimulation. But that is definitely a tough situation. I would really focus again on those visuals and kind of social stories of, when more than one person's talking, it's going to be a little bit louder, but it's okay because we're socializing, we're communicating with our friends.
Okay, great, thank you. And this question, I know my tone or expressions toward my child affect him in a negative way, tantrums and biting, but I want to know what I can do because he is a nonverbal and we want to achieve communication and skills. I don't know if you can answer this.
So if he's, tantruming and acting out in negative behaviors, I would recommend, well, first of all, I would recommend talking to your physician and hopefully getting a referral for some services, whether that be speech or occupational therapy. But secondly, I would see if he is I would try to figure out why he's tantruming. Is it your tone of voice? Is it you? Is it he's overstimulated by something? I would really try to find the root causes of the tantrums and the biting. If it is that he's struggling to communicate, I would really talk to your physician about that. I can't answer that without truly seeing your child, but that would be my first step.
Okay. And this question, my 10-year-old son is struggling with 1 and 2 step directions. He will sometimes do step 1 and then completely forget what he should be doing next. We've tried a few things, but I'm interested in your suggestions.
Yeah. So again, with that receptive language, which is where we do kind of see a little bit more of a breakdown in children on the spectrum, following one step and then completely forgetting the other is something that we do see a lot. So I would recommend either repeating it to him, breaking it down into 1 and 2 step, or 1 step each. I know that's not always convenient as the parent who has to kind of be overseeing things. I would also try having him repeat the direction back to you. If you give him more than 1 step, tell him, okay, now repeat it back to me. What did I tell you to do before he goes and does it? Or again, I am a huge supporter of visuals. So using some kind of visual to remind him of what your directives were would also work. But definitely try first having him repeat the directions back to you and kind of having him focus on what you're saying and then focus on what he's saying. That may help with following those multi-step directions.
Okay. And here's a question. What about an older child who's verbal, but misunderstanding the information or conversation and reacting the wrong way, sometimes acting negatively? What would we do in this kind of situation?
I think I would need to know more information about that as far as, how exactly are they reacting the wrong way? As if they're misunderstanding the information, or they're thinking that you're attacking them in some way, or they're shutting down. How are they reacting? I'm not sure what you mean by that, but if a child is misunderstanding information, again, that's that receptive portion, and why I think visuals help, because again, when we're talking to a child, we're just using sound waves. Visuals help make it much more concrete and really show what you're expecting of them. It sets expectations. But I think I would need to know a little bit more information to fully answer that question.
Okay, she's saying take the wrong meaning. The explanation. I don't.
Misunderstanding.
Mm, yeah.
So if they're misunderstanding, and they're just not understanding what you're telling them, again, I would rely more on visuals. I would rely on teaching the meaning of words, I guess, if that makes sense, and really helping them to, oops, I didn't mean to do that, to understand that language aspect.
Okay, and I think we have time for one more question. I know as a female with autism that my own actions as a child were very different from my son's. What things are different depending on gender for kids on the spectrum?
You know what? I'm going to defer that question to Dr. Barry.
No, that's fine. I think it's so highly dependent on the child, first of all. But there are some gender differences. Sometimes we see our girls on the spectrum being a little bit more introverted as opposed to extroverted. But in terms of some of the other issues, I think they're pretty similar, but I think everyone presents as different. And that's kind of why we always recommend sort of a thorough evaluation so we can look at exactly where the child is.
Wonderful. Thank you so much. In closing, I would just like to thank Michelle and Dr. Barry for their time in sharing this valuable information and answering your great questions. And thank you, audience, for your attention. A couple of reminders for you. We will email a link for you to view this session on our website once the recording is posted, and that will take about a week. So But just rest assured, you will get that link. And then please note that you will also be able to download a certificate of attendance from the email that we send to you. And then this note, please join us next month on April 14th, where our focus turns to feeding issues among children on the spectrum. And if you would like more information about the Rainbow Autism Center or the Neurology Department, please visit our website at uhrainbow.org/autism. And you can schedule an appointment with the Rainbow Babies and Children's expert by calling 440-596-5556. And if you're interested in resources regarding COVID-19, visit our website, uhrainbow.org/COVID-19. And this concludes today's session. Thank you for attending and have a great evening.